Hello, and welcome back for another chapter of the FNP Intense Review Certification. Today we're talking about Chapter 27, Professional Roles and Reimbursement Review. The Nurse Practitioner Role. History. Loretta C. Ford, PhD, RN, FAAN, and Henry K. Silver, M.D., started the first nurse practitioner program at the University of Colorado in 1965. Initially, it was a certificate program and later became a master's program in the 1970s. The first NPs were pediatric NPs who practiced in poor rural areas where there were no physicians because of a severe shortage of primary care physicians. Regulation of nurse practitioners, educational requirements. A and P must meet the minimum education requirements that are mandated by the Nurse Practice Act of the state, whichever one they plan to practice in. State Nurse Practice Act. The Nurse Practice Act is enacted into law by the state legislature. Therefore, the NP's legal right to practice is derived from the state legislature. Each state has its own Nurse Practice Act that contains regulations that dictate the educational requirements, responsibilities, and scope of practice for NPs and other nurses who may practice in that state. Nurse practitioner practice is not regulated by the federal government, the American Medical Association, or the U.S. Department of Health and Human Services. State Board of Nursing. The State Board of Nursing is responsible for enforcing the state's Nurse Practice Act. The SBON is a formal governmental agency that has the statutory authority to regulate nursing practice. The SBON has the legal authority to license, monitor, and discipline nurses. The SBON is also authorized to revoke a nursing license after formal hearings. Title protection. Professional designations such as RN, NP, or APRN are protected by law. It is illegal for any person to use these titles without a valid license. Title protection is under mandate by a state's Nurse Practice Act. Title protection protects the public from unlicensed nurses. Licensure and certification. Licensure is a legal requirement to practice as an NP. It is obtained through a governmental entity, the SBON. The NP must meet the minimal educational and clinical requirement in order to become licensed. Certification is generally a voluntary process and is done through a non-governmental entity such as a professional nursing association or specialty organization. The majority of states in the U.S. now mandate board certification as a condition to obtain licensure. Standards of professional nursing practice. Standards are authoritative statements of the duties that all RNs, regardless of role, population, or specialty, are expected to perform. According to the American Nurses Association, these include both the standards of practice and the standards of professional performance. They are developed by professional societies, as well as specialty organizations, an example of which is the American Association of Nurse Practitioners, publishes the standards of practice for nurse practitioners. So, an exam tip, NPs receive their right to practice from the state legislature. Collaborative practice agreements. The state practice environment differs for each specific state. Some states allow full practice under the exclusive authority of the SBON. Some states allow reduced practice, and some have restricted practice. In these states, the nurse practitioner must, under the supervision or delegation of an outside health discipline, such as the Board of Nursing or Board of Medicine. A collaborative practice agreement is a written agreement between the physician and nurse practitioner outlining the nurse practitioner's role and responsibility to the clinical practice. A copy of the collaborative practice agreement must be kept at the NP's practice setting and mailed to the SBON. Most states require an annual review of the agreement that contains signatures of the individuals involved and dates. Agreements with physicians and dentists. Nurse practitioners can sign collaborative agreements with physicians, osteopaths, and dentists or dental surgeons. Chiropractors and naturopaths are not considered physicians under Nurse Practice Acts. In some states, physicians are the only practitioners who can legally sign a death certificate. Prescription privilege. The majority of states require nurse practitioners to have a written practice protocol with a supervising physician in order to prescribe drugs. The protocol usually contains the list of drugs by name, class, or condition that a nurse practitioner is allowed to prescribe. In the United States, all 50 grant prescriptive authority to nurse practitioners, including the right to prescribe controlled substances. Prescription pads. The nurse practitioner's prescription pad or electronic prescribing record should contain the following: practice setting name, NP's name, designation, and license number. Clinic name, address, and phone number if the practice has several locations or sites. The other clinics where the NP practices should also be listed on the pad. To reduce fraud, it is best if the Drug Enforcement Administration or DEA number is not listed, only for controlled substance prescriptions. Food and Drug Administration controlled substances. Tamper-resistant prescription pads are required by Medicare and Medicaid, as well as when prescribing U.S. Food and Drug Administration or FDA-controlled substances. A controlled substance prescription can be typed, but it must be signed by the prescribing practitioner the day it is issued. Scheduling or Schedule II drug prescriptions. Substances in this schedule have a high potential for abuse with severe psychologic or physical dependence. These cannot be called in. They must be written on tamper-resistant pads and signed by the prescriber, not stamped. There is some variation among the different state laws regarding prescriptions of Schedule II drugs. Examples include codeine, morphine, hydrocodone, oxycodone, opium, fentanyl, methadone, and amphetamines. E-prescribing, or electronic prescriptions, a method of sending prescriptions electronically directly to the pharmacy. Preferred method of prescribing by Medicare and Medicaid. Nursing leadership styles. Situational leadership. Leader is flexible and can adjust their leadership style to fit the changing need of an organization, can establish rapport easily and bring out the best in people. The result is that staff members are engaged with the goals of the organization and are more productive. Situational leadership theory was developed by Ken Blanchard and Paul Hershey. Transformational leadership. Leader has the ability to communicate vision to staff members, may have charismatic personality, good communication skills. Staff members usually have high job satisfaction with this type of leader. Laissez-faire leadership. Leader engages in minimal supervision and direction of staff members, prefers a hands-off approach, may not like to make decisions. This style of leadership works well if workers are experienced, like autonomy, and are self-directed. New or unexperienced staff may feel anxious with this type of authority because of minimal supervision and feedback. Authoritarian leadership, or autocratic. The leader likes control and structure and prefers to give directions, may have many rules, makes decisions with no or minimal staff input. Motivated, independent, and self-directed staff may be unhappy in this type of environment. Democratic leadership. Leader may like to have more frequent staff meetings because they value staff members' input and feedback. Team shares and decision-making process, which may be slow due to the desire to include all of the staff in process. Leader values relationships and staff opinions. Servant leadership. The leader likes to work along with others in an effort to share power and encourage others to grow and develop. May assume many roles, develops relationships with staff members, and treats staff as individuals, which result in high job satisfaction for staff. But this type of leader may not like to make decisions that can be controversial. So, an exam tip is there are various types of nursing leadership. Malpractice insurance. Two types of malpractice insurance are claims-based and occurrence-based. So, starting off at the first, claims-based policy. This type of malpractice insurance covers claims only if the incident occurred when the NP paid the premium and only if the NP is still enrolled with the same insurance company at the time the claim is filed in court. The claim will not be covered in the future if they do not have the same insurance company as when the lawsuit was filed. Buying tail coverage can help address this issue. Tail coverage insurance will cover the NP for malpractice claims that may be filed against them in the future. When the NP with claims-based malpractice insurance retires or changes jobs, it is advisable to buy tail coverage insurance. An example of this is an NP who has retired for 2 years has a claim filed against her for an incident that occurred while she was still employed and insured. The nurse practitioner discontinued her claims-based malpractice insurance when she retired. In this case, the claim will not be covered, but if she had bought tail coverage, then it would be covered. Which brings us to the second type, occurrence-based policy. This type of malpractice policy is not affected by job changes or retirement. If a claim is filed against an NP in the future, it is covered if they had an occurrence-based policy at the time the incident occurred. An example of this would be an NP who has been retired for 2 years has a claim filed against her for an incident that occurred while she was employed and insured. Since she carried an occurrence-based policy, the claim will be covered. So there are again some exam tips. Claims-based malpractice insurance will cover claims only if the NP is still enrolled with the same insurance company at the time the claim is filed in court. Occurrence-type malpractice insurance will cover a lawsuit in the future even if the NP no longer carries the policy, as long as the NP had an active policy during the alleged incident. Malpractice lawsuits. A plaintiff, the patient or whoever is acting on behalf of the patient who files the lawsuit claiming injury and or damage by another party. The defendant, the party who responds to the lawsuit filed by another party who claims an injury and or damage. The elements of a case. The plaintiff must prove that all of the following has occurred. A duty is owed, a legal duty exists. A duty was breached, not following standard of care. The breach caused an injury, proximate cause, and damage has occurred. The phases of a medical malpractice trial. A lawsuit is filed in the appropriate court. The discovery phase, which requesting of medical records, deposition, expert opinions may occur. Plaintiff has the burden of proof. Court trial phase, or settle out of court, or arbitration may occur. Judgment is given, in either the case is dismissed or damages are awarded from physical harm, emotional, or mental harm. Which brings us to an expert witness, or witnesses. Ideally, the nurse practitioner who will testify as an expert witness should be someone who practices in the same specialty and geographic area as the nurse practitioner defendant. For example, an NP who practices in Los Angeles, California may not be the best choice as an expert witness for an NP who is being sued and who is practicing in Miami, Florida. Reimbursement Budget Reconciliation Act of 1989, H.R. 3299. The first law allowing NPs to be reimbursed directly by Medicare. Prior to this act, only certified pediatric and family NPs were allowed to be primary care providers as long as they practiced in designated rural areas. The Balanced Budget Act of 1997, together with the Primary Care Health Practitioner Incentive Act, this law broadened Medicare coverage of NP and clinical nurse specialist services. The Health Insurance Portability and Accountability Act, or HIPAA, of 1996 required health providers to have a National Provider Identifier, or NPI number, to bill Medicare and Medicaid. Nurse practitioners can be reimbursed directly by Medicare Part B, Medicaid, TRICARE, and some health insurance plans. Medicare will reimburse NPs at 85% of the Medicare physician fee schedule. National Provider Identifier Number, or NPI number, is a unique 10-digit identification number assigned to the healthcare provider or to any entity that bills Medicare Medicaid. It is issued by the National Plan and Provider Enumeration System. All providers who provide services and bill Medicare must have an NPI number. Individual healthcare providers may obtain only one NPI for themselves. To become a Medicare-approved provider, one must first obtain an NPI number online. An individual provider's NPI identifier lasts their lifetime. The identifier does not change regardless of state or group affiliation. Medicare requires the NPI number for financial transactions. Electronic claims submissions is required by Medicare and Medicaid. Medicare uses electronic fund transfer, or EFTs, to reimburse providers. Incident to billing and Medicare. Incident to billing is a way to bill Medicare for outpatient services rendered by a non-physician health provider, nurse practitioner, physician assistant, and receive the 100% physician fee. The location of the service can be at the physician's office, a separate or satellite office, or an institution or in the patient's home. During the first visit, the physician must evaluate the patient and write a care plan. Follow-up visits by the NP can be billed as incident to so long as the same health problems are still being addressed. The physician's NPI number is used to bill for the service. The incident to billing is reimbursed at 100% of the physician rate, but if the same patient is seen for a new problem by the nurse practitioner or PA, then the visit is billed under the NP's or PA's NPI number for 85% of the physician's fee. Medical coding and billing. Every time an NP bills Medicare, Medicaid, and/or a health insurance plan, they must submit an electronic claim. The claim form, or the superbill, must contain both the International Classification of Disease, the 11th edition, or ICD-11, the World Health Organization codes, or the diagnosis of the current procedural terminology, CPT code. If a bill is missing the ICD-11 code or the CPT code, the bill will be rejected or not paid, and it has to be resubmitted with the required information. The services rendered must show medical necessity and the appropriateness of diagnostic and/or therapeutic services that were completed. So, what is the ICD-11 code? The ICD-11 code is used to indicate the patient's diagnosis as determined by the International Classification of Disease, 11th edition, by the World Health Organization. Each disease is assigned a specific ICD-11 code. So, exam tips. The NPI number contains 10 number digits. The ICD-11 is used for diagnosis codes. The CPT code is used to bill for outpatient office procedures and services. Both the ICD-11 and CPT codes are required for each bill. So that brings us back to what is a CPT code? The CPT is a 5-digit code or alphanumeric code that is used to identify medical procedures, such as suturing, incision, and drainage, and other medical services. It is owned and maintained by the AMA. What are evaluations and management service codes? Evaluation and management services codes are used to bill for patient visits and are part of the CPT. If a bill is missing an E&M code, the healthcare provider will not be reimbursed for the time they spent with the patient. E&M codes are based on the history, examination, and medical decision-making complexity that takes place. The provider must document these three components have been met or exceeded. The complexity and time spent with the patient are assigned codes by the CPT system. An example of this would be a problem-focused visit requires documentation of the chief complaint with a brief history of the present illness, but it does not require a review of systems or a past family and/or social history. So, tips for the exam: identify a problem-focused visit. See what examples and what are evaluation and management service codes. Incident 2 billing is used for Medicare patients and refers to billing of a follow-up visit performed by a non-physician provider billed under the physician's NPI number. The non-physician provider is paid 100% versus the rate of an NP or PA who only will receive an 85%. Which now brings us to Medicare and Medicaid. Both Medicare and Medicaid programs are under the aegis of the Centers for Medicare and Medicaid Services. The CMS is one of the agencies under the U.S. Department of Health and Human Services. So, Medicare Part A. Inpatient hospitalization. Automatic at age 65 if the person paid the premiums, automatically deducted from paycheck by the employer, if the person never paid the premiums, e.g., never worked outside the home, the person is not eligible for Medicare coverage. Also, covers persons with end-stage renal diseases at any age. Certain religious groups, Amish or Mennonite, do not participate in Medicare. Medicare Part A will pay for the following medically necessary services: inpatient hospitalizations, including inpatient psychiatric hospitalizations, hospice care, home health care, skilled nursing facility care. Medicare Part A will not pay for custodial care, nursing homes, or retirement homes. Which brings us to Medicare Part B, outpatient insurance. Medicare Part B is a voluntary program with monthly premiums. One must enroll during the general enrollment period. Medicare Part B will pay for the following medically necessary services: outpatient visits, including walk-in clinics, urgent care clinics, and emergency department visits; laboratory and other type of tests, EKGs, X-rays, and CT scans; durable medical equipment; second opinions with another physician for surgeries; kidney dialysis, outpatient; self-dialysis equipment, supplies, organ transplants, and many others; ambulance services for emergency care or transportation to a hospital, or SNF if a transport in any other vehicle will endanger patient health. Medicare B does not pay for the following: most eyeglasses and eye exams, except following cataract surgery that implants an intraocular lens. It will not pay for hearing aids. It will not pay for most dentures and dental care. It will not pay for cosmetic plastic surgery unless it is medically necessary. It will not pay for over-the-counter drugs and most prescription drugs. Medicare Part B does, however, pay for some health prevention services. So it will pay for abdominal aortic aneurysm screening. It will pay for influenza shots once a year and pneumovax and the Prevnar 13. It will pay for screening mammograms once every 12 months for all women age 40 plus. It will pay for hepatitis B vaccine series for individuals at medium or high risk. It will pay for hepatitis C screening if at high risk. It will pay for screening colonoscopy or a flexible sigmoidoscopy for age 50 and older, and then every 10 years, as long as you are at low risk. It will pay for routine pap smears once every 2 years or once every 12 months for women at high risk. It pays for prostate cancer screening, the digital rectal exam, and prostate-specific antigen once a year after age 50. Bone density testing allowed once every 24 months if at risk for osteoporosis, taking prednisone or taking a biphosphonate therapy to monitor progress. It pays for HIV screening, STI screening covered once every 12 months, physical exams once a year, smoke cessation counseling and treatment, alcohol misuse screening and counseling, diabetic screening twice yearly if at risk, and lastly, it will pay for cardiovascular disease screening. Medicare Advantage, or Medicare Part C. Medicare Advantage plans cover both inpatient care, Part A, and outpatient care, Part B, and some plans cover some prescription drugs. They are administered by private health insurance companies approved by Medicare. Medicare Part D, also known as the Medicare Prescription Drug Benefit. Only individuals who are enrolled or eligible for Medicare Part A and or Part B are eligible. One type of Part D coverage is called the Medicare Advantage MA plan. All prescription drugs plans have a list of preferred drugs or formulary. If a non-formulary drug is used, it may not be covered and the patient has to pay for it out of pocket. Medicaid, authorized by Title XIX or 19 of the Social Security Act, a federal and state matching program provides health insurance coverage for low-income individuals and their families who meet the federal poverty level criteria. Covers children, pregnant women, adults, seniors, and individuals with disabilities, such as blindness, and pays for healthcare and prescription drugs. Currently, Medicaid is the single largest payer for mental health services within the U.S. It covers care offered by substance use disorders and family planning services, including contraception, as well as by maternal and infant health programs. Children health insurance programs. The Children Health Insurance Program, or CHIP, and the Children Health Insurance Program Reauthorization Act of 2009, CHIPRA, covers uninsured children, infancy to adolescence, as well as pregnant women. So, exam tips. Medicare Part B will pay for an ambulance for emergency care. If transport in any other vehicle will endanger the patient's health, transport by ambulance is allowed. Medicare Part B, however, does not reimburse for dentures, eyeglasses, or hearing aids. Health technology. Health technology such as telehealth is a broad term that encompasses a range of services and technologies designed to extend access, capacity, and delivery of healthcare, as well as to improve patient care and outcomes. Services include live video conferencing, such as consultation between patient and provider, patient monitoring, devices that remotely collect and send patient data to providers or testing facilities, and mobile health, patient health portals, or personal health apps. Telehealth is not restricted to clinical services. It can also include a wide range of non-clinical services, such as provider training and continued education. The full list of services payable under the Medicare Physician Fee Schedule can be found at the following website. Telemedicine A subset of telehealth refers to remote clinical services provided via secure audio and video connection. Telemedicine is commonly used for management of chronic conditions, medication management, follow-up visits, and specialist consultation. Health Information Technology for Economic and Clinical Health Act. The Health Information Technology for Economic and Clinical Health Act, or HITECH Act, was signed into law back in 2009 as an incentive for healthcare providers to adopt the use of electronic health records and supporting technology. The act included incentives for early adoption of those technologies until 2015. After 2015, it began to issue financial penalties, reductions of Medicare and Medicaid reimbursement for providers and entities who had not adopted EHR technologies. In addition, it strengthened enforcement of HIPAA security and privacy laws and penalties for breaches. Which now brings us to our knowledge check. There are 10 questions, so get your pen and paper ready and we'll start looking at the questions. A patient whose only source of insurance is Medicare Part A may be responsible for the entire cost of what type of care? Inpatient hospital care, inpatient psychiatric hospital care, custodial care, or a skilled nursing care facility? Question 2. The nurse practitioner is discussing Medicare Part B with a patient. The nurse practitioner realizes there is a need for further patient education if the patient states, Medicare Part B covers me because I'm older than 65. Medicare Part B will cover the cost of my wheelchair. Medicare Part B will cover my mammograms since I'm older than 50. And Medicare Part B will cover the anesthesia I received during my emergency appendectomy. Question 3. Some nurse practitioners bill directly for their services. Regarding reimbursement, who is considered a third-party payer? A. The patient. B. The healthcare provider. C. Health insurance company. Or D. The federal government. Question 4. Medicare Part D reimburses for which of the following services? A. Preventive health care, such as a routine pap smear and physical exam. B. Prescription drugs. C. Alcohol use disorder counseling. Or D. Over-the-counter drugs and vitamins. Question 5. Which of the following statements is accurate regarding the HITECH Act? A. It requires immediate conversion of patient records to electronic format. B. It provided insurance coverage for children and pregnant people. C. It provided financial incentives for adoption of telehealth technologies. And D. It encouraged the adoption of electronic health records. Question 6. Nurse practitioner and clinical nurse specialist derive their legal right to practice from which of the following? The Nurse Practice Act in the state where they practice. B. The laws of the state where they practice. C. The Medicare statute. Or D. The Board of Nursing in the state that they practice. Question 7. Which is a true statement regarding claims-based malpractice insurance policy? If the insurance company lawyer finds the nurse practitioner negligent, it is the nurse practitioner's responsibility to pay for the claim. B. Claims against the NP are covered as long as the NP had an active malpractice policy at the time of the incident. C. Claims against the NP are usually paid if the NP is found not to be negligent. And D. Claims against the NP are covered if both the incident and the claim happened when the policy is still active. Question 8. Which of the following statements is correct regarding certification for nurse practitioners? Certification is granted by state boards of nursing. B. Certification dictates the scope of practice within the United States. C. Certification grants the ability to practice within a state. And D. Certification is obtained through a non-governmental entity. Question 9. Which statement is true regarding a medical malpractice trial? A. The plaintiff claimed that injury or damage could have resulted from malpractice. B. The discovery phase determines damages after judgment is given. C. The defendant has the burden of proof. And D. The plaintiff must prove that a breach of duty has occurred. Final question. Which type of leader shares decision and activities with group participants? A. Democratic. B. Authoritarian. C. Laissez-faire. Or D. Situational. Let's take a look at the answers. So, question 1 was custodial care. Question 2 was D. Medicare Part B will cover the anesthesia I received during my emergency appendectomy. Question 3. The health insurance company. C. Question 4. Prescription drugs. Question 5. D. It encourages adaptation of electronic health records. Question 6. A. The Nurse Practice Act in the state where they practice. Question 7. D. Claims against a nurse practitioner are covered if both the incident and the claim happen when the policy is still active. Question 8. D. Certification is obtained through a non-governmental entity. Question 9. D. The plaintiff must prove that a breach of duty has occurred. And last but not least, question 10A. Democratic. So, you tell me in the comments how you did, and I'll see you all at the next chapter. Till then, take care and goodbye.